international funding, it's very difficult to deny that's been a huge part of the story, especially for the lowest income countries. And then both the innovative industry and the generic industry have brought things to these case studies. And the innovative industry, in terms of the case studies, offer different deals based on affordability. So this has been important in terms of particular medicines. It has been important in terms of the whole evolution. Voluntary licensing has clearly been important in some markets, much more significantly than others, but the impact of that has had repercussions for the impact on some of the other countries. So the actions of the innovative industry since 2000 have been significant. The actions of generic manufacturers are clearly very important as well. They are the largest supplier of many of the antiretrovirals in the lowest income countries. This has clearly been a significant part of the story. Now, in terms of direct effect, we don't think compulsory licensing on the basis of the case studies is very significant. 3 products, 1 product is paragraph 6. But that's only part of the story. There clearly is the potential use of the threat of compulsory licensing as a negotiating tool. We couldn't really investigate that in the case studies. We spent more time looking at that in the statistical analysis. So statistical analysis, and we were delighted to see Brenda on the panel of discussants. I'm a bit worried about how many notes she has on our report, but clearly statistical analysis in this area has been done by a relatively small number of authors, Brenda being one of the leading lights in this. And we've drawn a lot in terms of the methodology. We've clearly built on that in terms of some of the other things which we don't hold Brenda responsible for, and we'll take complete responsibility for those. But basically, what we're trying to do is use statistical measures to unpick the different policy interventions. As we've seen from the case studies, you can draw some general stories about what's been important in different markets. But in talking about their relative success, or talking about things that occurred at exactly the same time, it's very difficult to do that from 7 case studies. So we've tried to draw on a larger data set, and we've tried to do it through statistics. That has limitations, but it also has strength. And we've done 2 things. We first said, what are the factors that explain access? So given the improvement in access we've seen over the last 10 years, what is that correlated to? And which markets have done this? Are they the markets that have seen the greatest increase in access? Unsurprisingly, a big part of the improvement in access comes from the reduction in antiretroviral prices. That is a part of the story, as you'll see. It's not the only part of the story, but it is part of the story. So the second part of the analysis we've done is to try to understand what's driven that. How come have we seen antiretroviral prices fall so significantly over the last 10 years? What have been the contributory factors? And really, I suppose what we're illustrating on the right-hand side is if you look at any of these individual factors themselves, you can draw some conclusions. There clearly is some relationship between access and income. Higher income countries have higher levels of access. But as you can see, it's not a very close relationship at all. This is why we need statistical analysis. This is why the work that's done by different academics here is really important. We need to understand the degree to which income is important given the other factors after they're allowed for, but also what are the other factors that explain why so many of these dots are so varied, even for countries of the same income. So, cutting to the chase, and this obviously summarizes about 20 pages of the report. I apologize to the discussants for that. But going through that very quickly, what does the econometric analysis actually tell us? Well, let me, just before saying that, so what we've done in this analysis is bring together a set of databases. And to some degree this has happened before. I think to some degree we've added in some factors that have never been looked at. So we're clearly looking at access variables from the WHO. We include expenditure variables from UNAIDS. We use country characteristic variables to the extent possible from the World Bank. So we're allowing for some of the differences between the structure of countries and the nature of the population within countries. And then we are allowing for changes in price using GPRM. So we're bringing together a multitude of different data sets to try to say, is there a correlation between the improvement in access and some of the factors that proxy for the policy interventions which come out of the case studies? So we're trying to use this empirical analysis to say, which of these policy interventions has been most important? what do we find? Well, in terms of access, we find that access is positively correlated, so access increases with per capita income. Now you saw the picture on the right-hand side. We know there's a correlation. Even after allowing for other factors, I'm not sure it will be any surprise to anyone that richer countries have greater degrees of access. Variables that allow for the structure of the population, so the inequality within the country, have a relationship and a correlation to access. Higher prevalence rates have a higher level of access, perhaps reflecting a greater focus on countries with a higher level of prevalence. Countries in sub-Saharan Africa have a lower level of access, even after all the efforts that have been made. Time since launch remains important. We saw that coming out of the case studies in a statistical analysis, even after allowing for everything else. The time at which you started this program remains an important factor many years after that has been done. This is a gradual process of improvement. And then the ones, I suppose, we would imagine. Expenditure, clearly, both expenditure in the health system as a whole, but more importantly, expenditure on HIV in the round. Foreign expenditure is an important part of the improvement in access, especially for low-income countries. And yes, lower cost of antiretrovirals has been an important part of increase in access. Then what we do in the report is go through and say, does that vary by type of country? And the answer is yes. Now, you have a smaller sample when you divide things up by smaller countries, so you have to have some of the cautions that econometricians will always say. But there are some very clear differences between the different countries when you start to run the analysis. Lower price ARVs has the biggest impact on low-income countries, has the smallest impact on upper middle-income countries. So, there are a range of factors. Many of the factors we described at the beginning are important. This result actually supports the case study result. Now, to some degree, the case studies are the ones where we've got compulsory licenses, so we would expect it. But when you generalize it and compare countries that used compulsory licenses and ones that didn't, we're not saying compulsory licenses didn't have an effect. We're saying other countries got a similar effect through other means. We can't find an impact for compulsory licensing. In terms of the average price of antiretrovirals, how have we got this? Well, partly it's through income. Partly there is a clear relationship between prices and income, and this is for products which have a generic competitor and those that don't. So there is a clear relationship between differential pricing is having an impact on prices independently of the role of generics. Where we have generics, we also have lower prices, and they clearly are a very important impact, especially in terms of bringing down branded prices. Where we have countries in sub-Saharan Africa, clearly that's resulted in lower prices. The activities, obviously we started this from Doha, and also the activities of the industry in terms of some of its actions, means that we do have a lower set of prices, even though access we saw was actually still worse compared to other countries. And more recent observations, in terms of more recent products, and in terms of observing those products more recently, have lower prices. We do just have a trend of lower prices, and the prices come down. That clearly is a big part of the success we've seen in terms of access. So, I apologize if I've overrun. What do you draw from this? Well, no news to anyone. Substantial progress in terms of providing access to HIV medicines, but still work to be done. The way that different countries have achieved that, again, probably not surprising to anyone in this room, is complicated. Countries have used different mixes of policy interventions, and they interact in complicated ways. Some of them are not debatable. Political commitment is a clear precursor to seeing improvement in access, and you see that through the timing of improved access across the case studies. Comes out very clearly from the econometrics.